Okay, so what I'm going to do is I'm going to go through our presentation. It's probably about 20 slides. If you have questions as we go through it, by all means, go ahead. Other members of your brand may have similar questions, so go
Okay.
ahead, ask it. What I'm going to start off with is a little bit background on Franchise Benefit Solutions. I've been in the benefit sector for about 40 years. I've had over 35 years of experience in employee benefits. I am the managing director of Franchise Benefit Solutions. Franchise Benefit Solutions specializes in the marketing and administration of benefit solutions, targeting the franchise community. So like you mentioned before, you're looking for someone that understands franchisees, the franchise industry. Our name says it all. That's all we do. Our niche is the franchise community, and that's all we work with. So we've got over 35 years of experience specializing in customized benefit programs. Over the years, we've had the privilege of partnering with Authority Brands, Velpac, Comfort Care, Grocery Outlet, The Joint Chiropractic, and Jenny Craig, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed an interest in offering alternative benefit plans to help recruit and retain employees. Another one of your prerequisites that you mentioned. So what makes us different than local brokers? Like I said, we have solid understanding of the franchise industry. We focus on building a benefit strategy and developing long-term relationships. We help you with the training and support of prospective franchisees. Basically, when a new franchisee comes in, they don't really understand the ownership or owning a business. Most of them come from management of different businesses. So we help you with the back office, with the new franchisees that may come in. We will provide you with an online quoting portal, which allows your franchisees, the individual franchisees, to obtain instant quotes from multiple insurance carriers. And we'd offer you a branded web page linked to your corporate site outlining our products and services available. Why clients choose us, as you can see here with a few of our testimonials. One from Velpac, another from the sports club, which is part of the URSA Association. And then we have a Grocery Outlet clientele that we have their franchisees. They're mainly a Western franchise system, but they've got about 500 stores pretty much on the Western part of the country that we work with. Our advantages: we offer affordable group plans and rates, all guaranteed acceptance and no waiting periods. Plans and rates are the same no matter where your franchisees are located. If you have a franchisee in Florida, Michigan, Washington, or California, the plans and rates are the same. There are no participation or contribution requirements. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. Franchisees can choose the benefits they want to offer their employees, and employees can enroll online through our online portal, which I'll get into towards the end. Our program portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. We offer 3 health plan options: individual and families, comprehensive group, and then voluntary group. Our individual and family are for those employers that don't want to offer a group plan for their employees, but are looking for an individual health plan for themselves or their family. We offer an online quoting portal they can view at their own convenience. A lot of times your individual franchisees don't have the time during the day to talk to us or want to. So in the evening, whenever they, at their own convenience, they can go on our individual portal and then put in their information, and then plans will appear from the lowest rate to the highest rate. So once they input their personal information, they can compare affordable health plans from different carriers, find out if they qualify for financial help through the marketplace. They can view benefits at a glance, view local providers, and apply online or download enrollment forms. So as you can see here, they would input their information here, input if they're looking on the exchange or off the exchange. And then once they put their information in, this is what will come back. And it just happens to be here in Michigan where I'm at. If they're looking, depending on their income, they could see what the estimated subsidy that they would earn. And then from the lowest rate to the highest rate would appear. And the rate here is $432, but this also includes the subsidy. So again, they can see the plan details. They can look at different plans, compare it, and then find doctors and then add to the cart if this is something that they want to look at further. If a franchisee is considering their group options, we can help them make the right decision that it best meets their healthcare needs of their business and their employees. Group plans are based on the demographics of their company, along with their employee and dependent ages. We would need a census information in order to provide them with a group plan. So there are two types of group plans. One is the ACA, which is the Affordable Care Act, and the other is the non-ACA, which was available prior to the ACA. There's difference between both of them. The ACA compliant plans are community rated, while the non-ACA are based on the demographics and medical history of the employees. So non-ACA plans can be much lower in cost than the ACA plans. ACA plans require a minimum of 2 enrolled employees and will accept eligible waivers such as Medicare, Medicaid, Marketplace, spousal coverage, and other group plans. Non-ACA plans may require a minimum of 5 employees and will not accept any waivers. For example, if a franchisee has 15 employees, a minimum of 7 employees are required. So again, the first I showed you was the individual. Now this is the comprehensive group plan. Would be a plan such as United Healthcare or Blue Cross, that type of program. So this is the comprehensive. So this is a plan that covers everything. So far, I've covered 2 of the 3 healthcare options, the individual and family, and comprehensive. Our third and most popular option is our low-cost voluntary health plan, similar to an association health plan. Our voluntary MEC plans, which are the MEC plans here, and limited plans, which I'll on the next slide, are about access easy, low hurdle access to the healthcare system, otherwise unattainable for many employees. So basically, these are plans that employees can't afford, such as the comprehensive. An average cost may be $400 to $700 a month. These are low cost healthcare plans. The basic MEC, which is the first plan here. Gotta go back. The basic MEC covers physicals only. So as you can see, it covers the common wellness and preventative services, such as a wellness exam, immunizations, any type of testing or screening, blood pressure, diabetes, cholesterol screenings, flu shots, colonoscopy, and mammography screening. All that is covered at 100%. So The cost on it is $58. The average cost of a physical is around 3,000 to 5,000, depending where they go. So the cost on this is $58 for a single. So the basic MEC covers preventative services, while the MEC Plus covers preventative services, primary care and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. As you can see here, the primary care visit, $15 copay, that's all they pay. Specialist, $15 copay. Urgent care and lab and x-ray, $50 copay, no balance bill, that's what they pay. And prescription drugs, generic, $15 copay. Okay, what is not covered under this is inpatient, outpatient, and emergency services. That's why the cost is just over $100 a month. Okay, but I'll show you what most employers offer in lieu of the services that aren't covered, and offered as a voluntary benefit. So again, we've got the basic MEC, MEC Plus, you've got the premium MEC, which again is the same as the MEC Plus, but it also includes value-added benefits, which is a cash benefit payout to help avoid financial crisis. This would be a plan that's offered through Aflac. Okay, so the top part is simple copays, no balance bill, similar to a comprehensive plan. And then you have the value-added benefits. The Super MEC, same thing, but it offers additional benefits. Okay, so it does offer some admission, hospital admission, confinement, accident, ambulance, diagnostic, treated testing, critical illness, and then a term life rider. And as you can see, the cost does increase. Okay, but it's still quite a bit cheaper than a comprehensive plan.
Right.
So these plans do not have employer participation, which means that the employer can offer it and don't have to contribute towards it. There's no contribution requirements, like I just said. And the plans are the same in all 50 states. Okay. So we also have a limited medical plan, which is similar to the MEC plan, except this plan, while not comprehensive like major medical, help defray some of the out-of-pocket costs associated with major medical. So basically, this plan does have a balanced bill. So let's say one of your franchisee employees goes to the doctor and the cost is $100. This plan will pay $60 with a max, of 4 per year. However, if it's $100, then the employee will pay the balance of the $40.
Okay.
So there is a difference between this one and the MEC. We probably sell about 80 to 90% more of the MEC plans than the limited plan, just because of the balance bill, because the MEC plans, if the employees feel like I'm just going to pay a copay and that's all I have to pay. Okay, so there is a difference, but this one also includes outpatient lab, outpatient surgery, anesthesia, hospital emergency, urgent care, hospital room and board, hospital admission, and prescription drugs. And you'll see the cost on here is $93. So it's not going to pay the whole bill by any means, but it does give them some type of coverage.
Got it. Okay.
Okay, and there's no pre-existing, no waiting periods. That's what a lot of the employees and employers look for. Additional benefits we offer: dental. We offer 4 plans. The advantage of our program is we have no waiting periods. We'll take that employee from day one, whereas most plans these days have a 12-month waiting period. For major and basic services, we have no waiting periods.
For major and basic?
Correct.
Oh, that's great.
We offer 4 vision plans, 2 from VSP and 2 from IMED, and those are the number 1 and 2 providers in the country. Life insurance, we offer two plans, one an employer pay of 10,000 and the other is voluntary plan. Employee can purchase up to 150,000, spouse 50 and children 10,000. Guaranteed issue is the same amount and we have no medical questions. We take everybody. Okay.
Great.
Additional plans, telemedicine, which is a big enrollment these days after COVID. What's good about it is, let's say you're at the office and you feel sick, but you can't go home because you have a webinar. So you can talk to a doctor, give them your symptoms, they'll give you a diagnosis, they'll even call in a prescription. I know it works because my son had something in his eye. He took a picture, uploaded it to his portal. The doctor looked at it and called in a prescription for him. So
Great.
it's $11 a month and it covers up to 5 members per family. Accident and critical illness plans are available. Accident covers up to 50 different benefits on and off the job. In addition, they'll pay lump sum payments for fractures and dislocation. And it's guaranteed issue, no underwriting required. And the plan and rates haven't been changed since 2014 when we actually put it in force. So it's been the same plan, same rates. Critical illness provides a lump sum payment of 20 or 10,000, depending on what they want to select. And it pays upon diagnosis of 20 covered illnesses. It also includes, and there's no cost for dependent children, where it covers up to 25% of the primary insured amount. Hospital indemnity, this is the one I mentioned that a lot of employers offer along with the MEC plans. It covers both injuries and sickness. Has an admission per day hospital confinement benefits, which are included. Covers outpatient medical treatment received in a hospital emergency room or the doctor's office. Surgery and anesthesia benefits, along with diagnostic testing and prescription drugs, are covered as part of the hospital. So we have a mid plan and a high plan. We offer short-term disability. 3 benefit options, 500, 1,000, and 1,500. Plan pays 60% of whatever benefit they select, and it pays for up to 6 months. There is a 14-day waiting period for both sickness and accident benefits. Reason I'm bringing that up, we seem to get people calling us and say, hey, I've got COVID. I want to claim on short-term disability, but then they didn't realize they had a 2-week waiting period. So we do try to let them know right off the bat. It's on the enrollment platform. There is a 14-day waiting period. And finally, we offer a discount prescription mail order, which is free. Savings up to 80%. It's through the Canadian Med Store. It is on a 90-day supply. I know this is a good plan because I had a client call end of last year that was paying $1,400 for 90-day supply, and we cut it down to $400.
Oh, wow. Okay.
That works good. Additional services. We offer consolidated billing, online HR services, a Section 125 premium only plan, which is a IRS plan that allows employers to deduct contributions from the employees. And then we offer COBRA administration. Our benefits platform includes 4 steps from the initial contact to enrollment. So from the initial contact of speaking to one of your franchisees all the way through step 4, which is our enrollment. So step 1 is a discovery. The first step is to identify employers' objectives of offering benefits that reflect both the employer and the employee's needs and budget. We will gather group information, discuss the employer's goals, benefit options, and their budget. Step 2, which is the analysis. This is where we obtain quotes. It's important for employers to be strategic when deciding what to offer. We will review benefit options, cost, and help set up benefits program that will help the employer attract and retain employees. And this is what you were talking about as a main part
Yeah.
of what franchisees are looking for. Step 3 is communication. So once the employer or franchisee tells us, hey, we want to go with your program, then the step 3 is the communication. The communication strategy is a critical component to the benefit planning and management. We will develop easy to understand benefits communication for employers to share with their employees. We'll also conduct a benefits webinar if they so choose. And then this will lead up to building out our online enrollment platform, which is step 4. We will help the employers spend less time collecting and reviewing forms by setting up the portal, and it will communicate the benefit details, what's available for the employees. They can select the benefit options that best suit their specific needs. So what we do is we set it up, we show it to the employer, they confirm everything. We then obtain the census information from the employees, the contact info, upload it to the system, send logins out to all the employees. They register, they go through the process of enrollment. You probably have done the same thing with your company, but
Right.
this is how we would work with the employers. It's one application, one bill, one online enrollment and administration system. So looking ahead to 2023, there are 2 types of enrollment periods. One is the individual. This is the enrollment period through the marketplace, through Obamacare. And the other is group special enrollment period. This is the one that you probably haven't heard of. Most employers haven't heard about it. The reason is because insurance carriers don't want you to know about it, and insurance agents don't want you to know about it because they hardly make any commission on it. So what's good about it is it's under the ACA. Carriers are required to offer an annual group special enrollment period to employers who do not meet participation or contributions requirements. And what I mean by that is under normal circumstances, if a group came to us and says, I have 10 employees, I'd like to enroll in a group plan, I only have 2 that would want the program. In order to enroll, we have to have 50% of participation, so they wouldn't qualify.
I see.
Contribution, the employer has to pay 50% of the single rate. A lot of employers can't afford it. This is a 30-day window from November 15th through December 15th, which allows groups to enroll without any participation or contribution requirements, which is the 3rd bullet point. So this is where we write most of our business, is between that 30 days. It's like our accounting season. So it is a 30-day window, and we only require 2 full-time W-2 employees, and that could be the franchisee. Generally, when we work with the small group, it's going to be the franchisee, employer, or husband and wife. So they are considered as one, and then 1 active full-time employee. So again, this is the one time that we totally stress for employers. If you're looking for a group plan, comprehensive, this is time to enroll. So what are the most popular solutions for us to help your franchisees hire and retain employees? As you can see, as we're going through the presentation, hiring and retaining employees is the big tagline. So our packages, the number 1 package that employers seem to purchase would be where the employer offers the dual MEC plans and contributes towards the employee only cost. Employee then contributes the balance of the employee cost plus dependent cost and buyout. So what we find is that the employer may purchase the $58 plan for employees and then allow the employees to upgrade after that. Then the employer offers the voluntary benefits at 100% employee pay. So the employer is only going to pay towards the MEC plan. The employee pays for any of the voluntary benefits, the dental, the vision, the life, telemedicine. Now you'll see here in bold the hospital confinement. And the reason we embolded it is the MEC plan, along with the hospital confinement, is what most employers try to package together. So the employer will contribute towards the MEC, and then the hospital confinement, they'll offer it as a voluntary benefit.
Okay.
Package 2, the employer enrolls in a management-only group health plan through the special enrollment period, which I just explained. The employer sets the contribution level at ownership, 100%, management, 50%, and then the non-management employees, he offers the MEC limited, the other voluntary benefits, 100% employee pay. So as you can see, this is a management carve-out plan. Package 3 is the comprehensive program, where the employer enrolls in a comprehensive group plan for all employees. The employer offers dual medical option and contributes 50% of the employee cost. Of the lowest plan, the employee contributes the balance of the employee cost plus the dependent cost and any buy-up. So they'll offer more than one plan. They'll pay to the lowest plan, contribute, the employee pays the balance, dependent cost, and if they want to upgrade. We find that as quite a bit what happens, especially during the special enrollment period. In package 4, the employer offers voluntary benefits to all employees at 100% employee pay. So that they don't pay for anything, the employee pays for it all. So we do see that quite a bit for the employers or franchisees that may have 1 or 2 employees and they can't afford it. They'll just offer package 4. So these are the top packages that we find that franchisees look at the most. So training for your prospective franchisees. Many prospective franchisees come from the corporate world and aren't trained on how to run a business. We will help you educate your prospective franchisees with why they should offer benefits to their employees and help them set up a strategic benefits plan. In today's hiring market, a benefits package is essential for attracting and retaining top talent, as we've been talking about. Once franchisees have great employees on board, they want to keep them from jumping ship. So as you can tell, why offer benefits? We get into that. And then we also help them with setting up a benefits program and what to look for, what not to look for, and so on. So what is the projected scope and timeline to set up a program? We'll develop a program brochure for you, set up a branded page, provide online quoting engine, develop additional marketing resources with your help. We'll offer an introductory webinar for all your franchisees. Now, what we've done for Authority Brands, we had an introductory webinar for all their brands together. In addition, we had specific brand webinars. So
yeah, I was going to ask about that. So did you do a webinar for all the brands at once? Did they bring them all on at the same time?
Originally, yes.
Okay.
And then we cut it down to each brand.
Got it. Yeah, we'd probably have to do it for each brand if we go through with this. A lot of the brands have different forms of communication. Some do a lot of calls, some do a lot of webinars, and some just do a lot of email communications, things like that. So it might have to be a little bit more customized.
Right. Have you heard of their BIMAX?
Yeah, I have.
That's pretty much what we go through, is because they're adding all the different brands. We have one with the BIMAX, and then we'll have the webinars for each. But I think when we first kicked off the program initially, we had an introductory webinar for all the brands. But I think this is our 3rd year. And then now we have individual brand webinars.
Okay, great.
These take about 2 to 4 weeks to set this up. Here's what our branded page would look like. You can see you've got the home page on it, and then this just happens to be the MEC and limited plans on side by side, give them an idea what the coverages are. This is pretty much our program and what it consists to help hire and retain employees. I'm sure you probably have questions on different parts of the program and what we can do for you.
Yeah. Yeah, that was great. So with the branded page, is that a web page that you'll be creating, like a landing page for each brand? Is that what it would be? And we'd white label it, or
Well, generally what we do is we just have one branded page.
so we would just do it for 5-star then, and then just have everyone join that one.
Yes, we can do it however you want. I will
Okay.
tell you that Authority Brands did not want their name on it because of liability reasons.
Okay.
So basically, what I showed you was just a plain landing page, but it was exclusive for your franchise system.
Got it. Okay. That
So
sounds great.
I'm thinking this probably would be the same thing for you.
Okay. Yeah, I would assume so. Great. And so it'd be 2 to 4 weeks to kick off the overall partnership. And then what would the onboarding look like for a single franchisee? I think you already went through that 4-step process, right? That's the franchisee's onboarding process. Okay, great. And how long does that typically take for a franchisee to onboard?
We have some franchisees that we can get it done in 2 weeks. Again, it's really going to depend on their timeline.
Sure.
We do get franchisees that'll call us the day before they want it effective. Obviously, there's a little more involved because we go through the program. We want to make sure they understand it. If they're looking for comprehensive, we need census from them. If they're
Yeah,
looking
that's true.
if we're looking strictly voluntary, we've already got it set up. It takes no time, but the only part that really takes time, if they're going that route, is for them to complete the employer application, and then we need their census info. It falls on them, put it that way.
I see. Okay. Yeah, understood.
We already have everything in place on how we set each area up. It depends on how long or what it takes for them to obtain the information, get back to us, and then announce it to their employees, what they're doing, and then go from there.
Okay. Yeah, that sounds great. Yeah, I love the presentation. What we probably should do is let's just end the recording, and then I can send this recording to a couple of the brand presidents. Probably save everyone a little bit of time.
The other, okay, I just stopped it.
And then we can kind of discuss more of partnership and how that would look like with 5-star.
Yeah, the other thing that you may, let me make sure this